Have you ever been walking somewhere and suddenly you turn into a spasmodic ninja because you just walk into a spider web? Everyone around you is looking at you as if you're overreacting because they can't see the issue. That is the average life of living with polycystic ovarian syndrome. According to Angela Boss in her book, Living with PCOS, Polycystic Ovarian Syndrome, which I will now refer to as PCOS, named after the cysts that may form in your ovaries, is a hormone disorder that causes irregular menstrual cycles, obesity, and infertility, among other symptoms. Quoting Samuel Thatcher, PCOS, The Hidden Epidemic, when PCOS was described in 1935 by Stein and Leventhal, it was fairly rare. Nowadays, it's quite common, involving 6 to 10% of the female population, affecting 3.5 to 5 million women. Why the increased incidence? Some believe that endocrine disruptor chemicals in the environment are to blame. So PCOS is an endocrine disorder in females that causes them to have cysts on their ovaries, which affects their menstrual cycles, weight, and fertility. What and who is affected by PCOS? Females of childbearing age. It is said in recent studies, like womenhealth.gov, states 1 in 10 and 1 in 20 women has PCOS. As many as 5 million women in the United States can be infected. Girls as young as 11-year-olds can be affected. So let's think about that for a second. An 11-year-old girl who is getting ready to transition into womanhood by experiencing her first period. If she is affected by PCOS, she now has all of these other symptoms to deal with. And let's be honest, when you get your first period, you might be a little freaked out. So dealing with other symptoms on top of all of this other, coming into womanhood and experiencing all these things for the first time is a bit stressful as well as scary. The next thing that is affected is your body image. Your weight. Gaining weight for most women is already a sensitive subject and occurrence. Because women who suffer from PCOS suffer from hormone imbalance, their entire body functions differently. This causes women to not only gain weight at a surprising amount, but it makes losing the weight extremely difficult. Hirsutism, which means body hair, such as chest hair and hair on the face. This is not something any woman wants to deal with. It's already very unsightly. Some women have very severe cases and actually have full beards, where other women only have a few pieces of hair they need to pluck a week. But let's be honest, no woman wants to pluck their face constantly. There's also a symptom where women can get dark patches that appear on their neck and their back, and in some cases on the inside of their thighs. This is already uncomfortable because now you look as if you have 2 different skin tones. I myself have a darker neck than the rest of my body, and sometimes it makes me uncomfortable when I want to take a selfie because I'm concerned if anyone can see it or not. Is there a cure? Most women who are diagnosed with PCOS often have the same question, and one of them being, is this curable? There is no cure for PCOS, but there are treatments to manage the symptoms. So with that being said, when you go to the doctor and after you find out that you're diagnosed, first thing is like, well, what can I do to get rid of this because I don't want it? Unfortunately, they don't have a cure for it. So they will give you treatments to manage the symptoms. So they'll give you treatments to manage the hirsutism and the dark patches. They'll put you on pills to help you for, gaining the weight. And sometimes all of those things can cause more issues. Women who suffer from PCOS not only suffer from a condition that is not curable, but they suffer from something that makes them self-conscious. You now have gained weight, you have hair on your face, and dark patches all over your body. It's an uncomfortable thing and it's unsightly, as I stated before. But the one thing that you have to learn is that you can overcome anything. So even while you have your PCOS, you can